Most people don't like showing off their feet, but Sadie Dohan knew something was off.
They were very itchy, almost like bug bites.
Doctors in the US and Canada were recently sent an alert. Look out for cases of kids with purple, swollen toes.
Sometimes they're hot and painful. Sometimes the children are otherwise well.
The condition has been dubbed COVID toes, and doctors are being told to test patients for the virus.
The skin findings themselves are a self-resolving phenomenon and shouldn't be a cause for concern. But it is important that physicians be aware that this condition may be a sign of COVID-19.
Children pick up plenty of germs. The coronavirus is no exception. But in some ways, this virus is different.
COVID is acting differently than most other typical illnesses, such as influenza. It hasn't been really making children very sick.
Chinese researchers found about 6% of children infected with COVID-19 became severely or critically ill. In adults, it's nearly 20%. Doctors aren't sure why, but many suspect children might have a different immune response.
With this virus being novel, the novel coronavirus, we're learning new things every single day.
In an effort to get ahead of this disease, pediatricians are sharing information globally, including reports of a rare but severe inflammatory disease that's apparently being seen in some children in Europe. But Canadian doctors say those reports are not confirmed.
We don't know how many cases there are. We don't know if it's really an increase from what you would expect. And we certainly don't know if it's linked to COVID.
In serious cases of COVID-19, doctors say children do have the same symptoms as adults. If a child has high fever, coughing, and trouble breathing, they should be rushed to emergency. Christine Birak, CBC News, Toronto.
Okay, so we have Dr. Dina Kulik joining us just to chat a little bit more about this. And Dr. Kulik, how compelling is the evidence of a link between COVID-19 and COVID toes?
There's certainly a link. We're seeing more and more cases being reported around the world. Some people have confirmed COVID infection. Other people are still waiting for their test results. But around the world, we're seeing some kids with this rash and COVID infection.
And so given then that, what would you advise to parents who, if they see COVID toes or something similar and say no other symptoms, what ought they to do?
So in this case, because of this different kind of rash, we are actually recommending that these kids get tested for COVID. Many other symptoms like coughing or runny nose or fever or vomiting, most of us are saying stay home, stay away from people that are at higher risk of severe COVID infection, like the elderly and people with chronic health concerns. But because we're monitoring this rash so carefully, we're actually suggesting to families that if your child has this rash, even if otherwise they're asymptomatic and well, they should actually be tested for COVID.
Okay. Dr. Kulik, thanks for your time.
You're welcome.